Welcome back to ZeroDiabetes Zone, where we dive deep into everything you need to know about managing diabetes effectively. In today's video, we're exploring the fascinating role of magnesium in blood sugar control. Whether you've been managing diabetes for years or are newly diagnosed, understanding the connection between magnesium and your blood sugar levels could be a game changer. Magnesium is an essential mineral involved in over 300 biochemical reactions in our bodies. It plays a crucial role in muscle function, nerve transmission, and, importantly, blood sugar regulation. Despite its importance, many people don't get enough magnesium in their diets, which can be especially problematic for those with diabetes. Magnesium and blood sugar control. So, how exactly does magnesium influence blood sugar control? Magnesium helps our bodies use insulin more effectively. Insulin is the hormone responsible for transporting sugar from the bloodstream into our cells. When magnesium levels are low, insulin can't work as efficiently, leading to higher blood sugar levels. Studies have shown that people with low magnesium levels are more likely to develop insulin resistance, which can lead to type 2 diabetes. Signs of magnesium deficiency. Magnesium deficiency is often overlooked, but it can have serious consequences, especially for those with diabetes. Common signs of low magnesium levels include fatigue, muscle cramps, and even irregular heartbeats. If you're experiencing any of these symptoms, it might be worth getting your magnesium levels checked. How to boost magnesium intake? The good news is, boosting your magnesium intake is relatively simple. Incorporating more magnesium-rich foods into your diet, like leafy greens, nuts, seeds, and whole grains, can make a big difference. If you're not getting enough through diet alone, magnesium supplements are also an option. However, it's important to talk to your healthcare provider before starting any new supplement. Magnesium and medication. It's also essential to be aware that some medications can deplete magnesium levels or interact with magnesium supplements. If you're on medication for diabetes or any other condition, consult your healthcare provider to ensure you're managing your magnesium levels safely. Closing remarks. Magnesium plays a vital role in blood sugar control, and ensuring you have adequate levels can help you manage your diabetes more effectively. Thanks for watching. If you found this video helpful, give it a thumbs up and share it with anyone who might benefit. Don't forget to subscribe to ZeroDiabetes Zone for more tips on living well with diabetes. See you in the next video.